Hi, everyone. My name is Catherine Brumfield. I am the manager of career services at the Colorado School of Public Health. And today we are talking with Dennis Wright, one of our MPH alums, who's going to tell us about his career path. Hi, Dennis.
And hello, too. It's great to be with you again.
Can you tell us your concentration, the year you graduated, your current job title, and where you work?
Sure. I received my Master's of Public Health in Epidemiology, Colorado School of Public Health course. This was in December 2021.
Yes.
Currently, I am the lead cancer epidemiologist with the Center for Health and Evaluation Data at Colorado Department of Public Health and Environment.
And how long have you been working with this department?
I've been here for just over a year. I'd say closing in on a year and a half.
Yeah. Good. Cool. Dennis, something that I really want to touch on before we go into what you do in your current career is that you were a career changer.
Oh my
You
goodness,
had a
yes.
whole nother career before this, and that can be very scary for a lot of people to change careers. Could you talk a little bit about how you chose public health?
Oh, absolutely. Before this, I worked in various areas of quality, so quality assurance, quality control. I was in the bioscience sector for about 15 years. And most recently, I was making medicine at a big name pharmaceutical company. And my job is to make sure that it's good and out the door. And we made really good stuff. And what bothered me was that it only made it to people who could afford the medicine. And I started having a crisis of conscience. I said, there's got to be a better way to help the population other than the haves and have nots. So I was like, all right, there's got to be a better way to do this. I started looking into public health and I decided to, after a lot of help, take the plunge from a completely different field, taking the engineering work I did
Yeah.
into something within public health, which turned into epidemiology. There was a fair amount of overlap, which made the transition easy.
Yeah.
And I continued from there and have not looked back.
Yeah. Yeah. Well, we're glad to have you in public health.
And I'm glad to be here. Thank you.
So could you describe a typical day or maybe typical projects you work on in your current role?
No worries. One thing I will say is there is no typical day.
Yeah. That's
I have
pretty
found
common.
myself jumping from one project to the next. Just to spell it out, for example, I thought I would go into epidemiology. I would receive whatever project I'm working on. I would work that to the nth degree as almost like a researcher. But I was actually given 4 different roles when I got here. That I did not expect.
Oh,
So I am the epidemiological support for the Women's Wellness Connection,
oh, cool.
which specializes in breast and cancer screening services.
Nice.
Also, the Colorado Comprehensive Cancer Control Program. So that's the larger one that's part of the national program. Also, I assist with alcohol epidemiology. So, and that is actually one of my current tasks is pulling up this large list of coding that will help us analyze and develop output for how alcohol is consumed, uh, inputs and outputs across Colorado. And the
Oh,
last piece,
that's
what
fascinating.
there's a lot I didn't even know it existed before I got here. And there was a another where I do data analysis for the Office of Public Health Practice Planning and Local Partnerships. Long title, we just call it OPHP. Effectively, I work with local health agencies on their community health assessments. So that's doing with the data analysis, help them find resources. We also assist with the statewide health assessment. And so that's what's happening within Colorado as a whole, as opposed to maybe what's happening in one county versus another.
That's so
It's a busy
cool.
time jumping between one and the other. It was
Yeah,
not expected, but it's also extremely fulfilling.
that is so awesome. What systems do you use to analyze data?
Primarily, the work that I do, I code within SAS.
Okay.
One thing I learned was that oftentimes a lot of the code that you'll need probably has been built before. So being comfortable reaching out to others and say, hey, have you pulled up anything like this before is going to be wonderful. I thought I had to know everything going in. You don't. So don't feel as much pressure as I did. You'll get in and say, oh, okay, all I have to do is tweak a variable or two. We're fine. Also, we use things like Tableau. We've for building dashboards, maintaining them. We've also branched into the R platform for other ones. So using like the R Shiny package, for example.
Okay.
That's one of our newer applications.
Yeah.
Other than that, Excel, Word
Yeah.
documents, and a lot of Google, everything on the Google suite you can think of, doc sheets, everything else. So those effectively are what we'll use at various points throughout the day, every day.
Nice, nice. And what would you say like the top 3 skills you use in your current job are?
Ooh, great question. I think probably, and so I have a couple in mind, but it's hard to rank them. So
Well, you don't have to rank them.
I would say close in second would be between project management and assisting with data literacy around different parts of the department. Project management, because we have our own tasks enrolled within the chronic disease world, which is where I am.
Yeah.
And that is one set of skills. Just making sure you know what the program is that you're working on, how to help that our prevention services department get to where they need to so they can put in the interventions. Separate from that, there'll be data literacy that I help people with, whether it's within our group, outside of our group, actually within our group, we're pretty good. It's outside the group. But even outside of just typical program services folks. So sometimes we talk with marketing people. We'll talk with someone that's in the environmental, more on the environmental side. Okay, so what are you seeing? What are you hearing? Here's a good way to interpret the data that's helpful, that's precise, accurate, but in my world, equitable. A lot of the work I do is within the health equity field as well.
Nice. So I love this data literacy thing. That's so cool. So you're like meeting with people and educating them on the data, or like how they can use the data?
All of the above, I will say.
Okay,
There's
cool.
because the department as a whole is geared towards public health, but not everybody is, as we're comfortable saying internally, not everyone's a data geek.
Yeah, of course.
Some people are better with maternal and child health from the community side. Some people are really good with working from cancer at the clinic site. There are different places that require different levels of data literacy. Some want a number, give me that number, I can make things happen. Others want to know the information behind it.
Yeah.
And knowing where that line is for each folks requires a lot of discussion across departments, asking, listening, and then responding in kind.
Yeah. No, that makes sense. That's super cool. So one thing that I really loved about getting to know you is that you're not the normal epidemiologist. I guess I wouldn't say normal, but like
neither would I. It's quite all right.
Yeah. What would you say the type of epi that you do? Because it was a little bit different than what we're used to when we think of epi.
Right. I will make this as brief as possible. Most of the time when I heard about epidemiology growing just through the years and when I grew into the field, it was all about infectious disease. And I was not sure that's what I wanted to do, but I went through the program figuring it would reveal itself. I found chronic disease to be perfect for me, and I'm very happy working in that field. Along the way, I discovered social epidemiology, which that is the part that has made me everything that I am at this point. I had to craft a couple of courses. Okay, how do I pull in some more information to fit more of a social epidemiological context? Asking people, what have you heard? I took a class at CSU during my MPH program that was geared towards it. And so now I can actually talk with people around our department about social epi in ways that haven't been discussed too often before, if at all. And oh gosh, it fills me up. It fills my cup every day.
Well, it's so funny because I think when you and I first met, you were telling me about social epidemiology is what you want to do. And I was like, I don't really know.
Well, it didn't exist here.
Yeah,
I
what job that
yeah.
is. So I just love that you're doing the work that you want to do and it aligns perfectly with your career goals.
Well, I'm grateful that I have a team of people with me that support this. We talk together about it. I've even started a working group within just outside my immediate area. We get together every month and we talk about the things we find within social epi, how we can apply it in our day-to-day tasks.
That's so
And
awesome.
without a supportive team, there's no way that I think I could do this here in Colorado because that infrastructure didn't exist before that. You'll find one or two, but not much.
Yeah, yeah.
But the supportive team is everything for me.
What would you say the biggest difference between social epidemiology and um
More traditional,
yeah,
perhaps. That's
yeah,
usually where we say, yeah.
yeah, yeah.
I'd say um, likely the biggest thing you'll find is we focus on systems and structures. So
Okay.
we talk a lot about, and I'm sure anyone who's watching this probably will have heard through their courses, primary, secondary, tertiary prevention, upstream, downstream processing. Well, the way I like to talk about it is I look really far upstream. So we would look at how residential segregation could lead to cardiovascular disease or to kidney disease. We could look at where people live and how lead being forced to live in an area that has lead paint in them
Yeah, yeah.
could lead to other chronic diseases and illnesses.
Mhm.
How policies can drive public health. That's really what we look at. I like to say I look at who gets sick because of both who they are and who society says they are, and
Wow.
finding the equity component in there. And so it's upstream, but a little bit further upstream.
Wow. I love that.
It's root cause analysis, which is what I took from my old field, really.
Yeah, 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 yeah. You
You
just
ask why enough. Mm-hmm.
you really merged your old field with this field like beautifully.
I've been fortunate, really fortunate.
Well, you worked your
The
butt off.
work works. Oh, I definitely worked hard. There's no
I was like,
question.
you earned it.
That work is not nearly done. But there have also been a few things that have been more serendipitous than I would have expected.
Yeah, yeah,
Finding a wonderful school where I lived,
yeah.
finding good people to support the work that I do, and that help me follow the vision. And because I can do it myself, it's a lot better to do when you reach out and realize that's part of public health too. We are part of public health, not just as a workforce, but as a patient population. And we
Totally,
all
totally.
need that help. And that support has been monumental for me.
I always knew that you were gonna make big moves in public health, so I'm excited to keep my eyes
Trying
on
the
your
best.
career.
And I look forward to every year hereafter. And I'm so grateful to you for all the work you've been able to do to help me
No.
follow these things. I would never have seen myself in government or with the work that I was doing. I thought I was going to be a researcher, but
Yeah,
you
that's
helped me
right. I did
realize a
remember that.
lot more than I would have figured out on my own. So anyone watching, utilize her services. Don't overwhelm her. Just ask the questions. She is absolutely irreplaceable. So
No.
thank you,
Oh,
Katie, for helping me out as
Dennis,
well.
stop it. This is about
Eh,
you.
whatever.
All right, last question, because I try to make
Sure.
these pretty short.
No
What
worries.
advice do you have for people that might want to get into the field that you're in?
Ah, good advice. There are a lot of things that I've been told over time, and some of it's been great, some of it not so much. I would say keep an open mind and an open ear. Like I said, I would not have been in this field. I didn't even bother looking in here without someone else saying, keep it in mind. I looked, I decided it might work out, and I was very pleasantly surprised. So keep an open mind. Those fields are out there, even if they're not exactly where you think they should be. Just
Yep.
be aware they exist.
That's really good advice, especially in public health.
Oh my, there's so much of a breadth of public health that yeah, you will find something. You just have to keep looking and don't expect it to be exactly where you think it should be.
Yeah.
You'd be surprised. You'd be pleasantly surprised.
Yeah. Awesome. Thank you so much, Dennis. It's so nice to
Uh,
catch up with you and learn
Thank you.
about the amazing work you're doing for the state of Colorado. So thank you. All
My pleasure. And thank you for taking the time to talk.
right. Bye.